The following program is an original production of WICC PBS Chicago.
Tonight, families of some of Illinois' sickest children are suing the state over budget cuts to in-home care. We'll take a closer look at the human impact of the state's financial crisis.
No time for church? How about a side order of scripture at the drive-through window? From fast food to quick prayers, how serving Chicagoans in their cars is changing.
And tough decisions and declining approval ratings mark Bruce Rauner's first 100 days in office. What is next for the governor and the state? These stories and much more tonight on In the Loop.
Good evening. I'm Chris Beard.
And I'm Barbara Pinto. Governor Rauner promised that everyone in Illinois would feel the pain of deep budget cuts.
The governor is grappling with a $1.6 billion deficit in the current budget, and his administration has been looking for ways to save money.
Medicaid is one of many programs in the crosshairs, making the future uncertain for some of the state's most vulnerable residents. Every day of Hector Soria's 3.5 years have been a delicate choreography of care to keep him alive. Born with a rare disorder called Pallister-Killian syndrome, Hector cannot walk or sit up on his own and has a long list of complex medical issues.
He has a ventricular shunt placed in his brain. Other with his syndrome comes visual and hearing impairment, feeding problems, and mainly flaccid muscle tone. And he's also at risk for seizures.
Hector is one of 5 children living with his parents in this modest Berwyn apartment, and Lorena Aguayo has been there for him and his family every step of the way since the day Hector came home from the hospital.
They hand me this tiny little baby, and at first I was like, can I do this, But I saw Mom and Dad, they put their faith in me.
For 10 hours a day, 5 days a week, Lorena cares for Hector while his parents work. Medicaid picks up the bill. Among her many duties, watching for subtle signs of dangerous brain swelling and maintaining the feeding tube in Hector's abdomen.
When he's not sick, he will take the formula by mouth. But whenever he gets like a cold or anything, he doesn't eat through his mouth. So that's when I plug in a tube through here and I deliver the dosage.
Since Hector can't move on his own, Lorena does it for him.
And there's a few exercises we do, range of motion exercises, just to keep him moving. If we don't keep him active, his muscles could potentially atrophy and he could develop contractures. And with contractures, sometimes they have to surgically go in there and cut tendons and readjust what's atrophied in place.
Doctors say Hector currently functions at the level of a 6-month-old.
Push, 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 push. Yay!
Last October, Kepro, a Pennsylvania company hired by the state to bring Medicaid costs under control, paid a visit to Hector's family.
They just checked off boxes saying, oh, what does he do? What doesn't he do? And we just left it at that. We thought it was something routine, that had to be done.
2 months later, a letter arrived in the mail.
The letters basically said that we've reviewed medical records and based upon an assessment, your child no longer qualifies for in-home skilled nursing care, and we're going to reduce you down to 0 hours over a 6-month period.
Robert Farley is a Naperville attorney who says more than 100 families across Illinois received similar letters. Farley has filed a class action suit against the state on behalf of Hector and other children.
When a state bullies a family by saying you're not entitled to it, it's wrong. It's simply wrong.
Farley contends the state lacks justification to alter the medically necessary care given to Hector and other families, and that federal law guarantees Medicaid patients the right to that care. Kepro, the company paid more than $7.5 million by the state to evaluate Hector and other children on Medicaid, has yet to disclose the criteria they use to determine the suspension of services. Meanwhile, Hector's parents, who both work to support their 5 children, worry about what's next.
Probably we need to change the house, try find another cheap rent. I don't know, it's very hard to think what can I do.
What is sector? Right here.
No, no es justo. No es justo porque
I don't just want to sit here and rely on public aid to pay for our rent, for our food. We work for our kids. I think I'm asking for something fair for my son.
The state paid more than $37 million for the program providing nursing care to Hector and other children last year. To help solve the state's fiscal crisis, Governor Rauner wants to cut more than $100 million from Medicaid and another $26 million in social services, including programs for people with AIDS and autism. Critics say the governor is balancing the budget on the backs of the most vulnerable. But with so much debt, there are no easy answers.
I was with Governor Rauner earlier today. He doesn't want to make these cuts. He doesn't want to reduce these kind of programs. But we can't continue to operate a government that doesn't pay its bills.
Lawrence Massall, president of Chicago's Civic Federation, blames Illinois lawmakers, past and present, for not coming up with a plan to fund Medicaid.
It's not enough to say that you're against the cuts. You have to explain how you're going to pay for them or what else you're going to cut out of the state budget.
Attorney Robert Farley argues Medicaid cuts could end up costing even more. According to the class action suit filed on behalf of Hector and other families, the state pays about $7,500 a month for in-home nursing care. The alternative, inpatient treatment, costs $55,000. Attorney Farley says this fight is personal. He is also the father of a child with disabilities.
Those children are the most vulnerable people in society. Their families are doing heroic efforts to keep them healthy day and night, 24/7. They do not have the time or the resources or the expertise to litigate.
It's hard taking care of a disabled child. At least I get to go home, you know, and I go about my life, but this is their reality every day, every day. It's hard.
A federal judge in Chicago has issued a temporary restraining order that keeps nursing care in place for Hector and the other children affected by these cuts. Another court hearing is scheduled for next week. Now we'll look at the governor's first 100 days, Superintendent McCarthy's listening tour, and a history-making game for the Chicago White Sox. Here's Chris with more.